Welcome back to the second session of our InfoNTD festival. It's been a great pleasure over yesterday and this morning to hear a lot more about how creative approaches can really underpin and support research in the field of tropical diseases, but also programs out in the fields, and more importantly, to really engage and involve affected communities in public health programs. So in this session, we're going to be zooming in and focusing on skin NTDs, some of the conditions that pose some of the most difficult challenges when it comes to advocacy, communication, sharing research, treatment outcomes, but also from the patient's perspective, huge challenges linked to stigma, mental health issues, isolation, disability. So really a very complex web of challenges there. So I suppose this is the first step in what many people are calling hybrid events. So most of us are online, and then the NLR team has managed to find a COVID-safe way to meet and to tune into the festival in their own way. So from London, hello, NLR. Hello, Team NLR. Hi. And we'll be hearing more specifically from Anne Schoenmakers in a little while. Anne, who's not on screen at the moment, is a doctor and working with NLR. But our other panelists that I'm so pleased, and we're really, truly delighted to have you join us. So thank you very much. So first and foremost, we're joined by Andie Tucker. Andie, you are project manager at the Global Partnership for Zero Leprosy, based at the Task Force for Global Health. So hi and welcome, Andie.
Thank you.
Also joining us from Countdown. We've heard a lot from the Countdown's programs, and it's our pleasure to have again in this session Dr. Oluwatosin Adekeye. You're from the Countdown Wellbeing Study, as well as Sightsavers Nigeria. Welcome, Tosin.
Thank you very much. Good afternoon, good evening, good morning, depending on where we are.
Yeah, nice to see you here. Roos, Geutjes, welcome. You're with InfoNTD. You're the coordinator and information officer, and you will be talking in tandem with Anne Schoenmakers, who's, I think we can see her now, but Roos, hi and welcome.
Yes, thank you, Marianne.
Thank you. And finally, a very, very warm welcome to Hannah Mudge. Hannah, your Digital Innovation Manager at the Leprosy Mission, England and Wales.
Hello.
Hi, Hannah. Okay, well, we've got a lot of ground to cover and some really exciting approaches to discover today. So without any further delay, I'm going to hand over to you, Andie, and to hear a little bit more about your work and how this Global Partnership for Zero Leprosy is using communications to challenge stigma and also to build dignity in leprosy. So thank you.
Thank you for that wonderful introduction. My name is Andie Tucker. I'm a project manager at the Global Partnership for Zero Leprosy, and I'm really happy to be here today to talk to you about our organizational approach to communications and how we try and use communications as a tool to challenge stigma and to build dignity for the persons affected that we work with. So just a little bit of background about our organization. The Global Partnership for Zero Leprosy was launched in January of 2018. And our purpose is to facilitate the alignment of the leprosy community to accelerate effective collaborative action towards zero leprosy. And our vision is no disease, no disability, no discrimination, and no stigma. And that last one is the one we're going to focus on today. So we are a membership organization. This is actually just a sampling of the organizations that we work with. Organizations and individuals join the partnership as members to support the principles of the Global Partnership. We work with a wide variety of organizations, as you can see here, but most importantly for this presentation, I want to focus on organizations of persons affected by leprosy. And one of these organizations, the International Association for Integration, Dignity, and Economic Advancement, or IDEA, was one of the founding members of our partnership. And persons affected are represented in our working groups and serve on our leadership team. So a little bit of background about our communications. We're speaking today about challenging stigma and building dignity through communications. So I want to give you a very quick picture of the kind of communicating we do at GPCL. We communicate primarily with our members, including organizations of persons affected, with national leprosy programs and ministries of health in endemic countries, the global health community, government leaders in endemic countries, and we use a wide variety of tools and platforms like our newsletter, our website, social media, to share messages about our work, to share about significant events or issues facing the community that's working to end leprosy. And we also share tools and resources, as well as provide communications on many other topics. So we communicate with, to, and about persons affected by leprosy. So Chimamanda Adichie, in her TED Talk titled "The Danger of a Single Story," describes the danger of stereotypes. Stereotypes have the power to flatten people into one role, into one thing, and they present an incomplete picture of the complexity of a person. Stereotypes create a one-dimensional image instead of conveying the fullness of who people are. So when we think about portrayals of leprosy, images of leprosy are readily available online if you do a Google image search. And most of these images are very similar. They're mostly of hands and feet that show obvious signs of disability. They're often photographed on their own, apart from the person that they belong to. These images tend to be disembodied and decontextualized. They tell a very, very small slice of the story of this person on the other side of the camera. And sometimes photos like this are taken as a way to protect anonymity because leprosy is so stigmatizing, but sometimes they are taken and they are used to emphasize disability. The photo tells us almost nothing about the person whose hands and feet are pictured, and therefore the disability or disfigurement can become the whole story because it's the only part of the story that's being told. So myths about leprosy abound, like a myth that it causes extreme disfigurement, which leprosy does not have to if recognized and treated early. And these kinds of images can perpetuate negative myths and stereotypes and can increase stigma and misunderstanding of the disease. So this has very real consequences because stigma hurts the social and mental well-being of people affected by the disease. And it can also make people more likely to hide symptoms or illness to keep them from seeking healthcare immediately. This means that stigma can make it more difficult to control the spread of an NTD like leprosy. So stigma has consequences for the individual, but also consequences for the whole community. And we have to beat stigma if we want to beat NTDs. So how do we do this? How do we challenge stigma through the way that we use imagery? So at GPCL, we believe that we can challenge and reduce stigma by creating and using dignified, contextualized imagery. And by dignified, I want to be clear here, I mean photos that convey a person's humanity, that depict them as worthy of respect. These are the kinds of images that we think can counter stereotype. And I really want to acknowledge here that there are organizations and individuals within the leprosy world that have been pointing this way for a very long time, even before we existed as an organization. We stand on the shoulders of giants on the work that they've done before us. And I want to call out specifically the ILEP policy for the use of language, photographs, and imagery. This policy offers guidance on the way that organizations should talk about persons affected by leprosy, the way persons affected should be depicted, and how organizations should best work with persons affected to develop communications. And this policy was created in partnership with the ILEP panel of persons affected by leprosy. So we believe that persons affected are our best teachers in understanding how to combat stigma. They know better than anyone else. And what I know about stigma and how to fight it has been learned from my persons affected colleagues. And I do hope that the next time we have a conversation like this, we're able to have a person affected representative here to talk about the pace-setting work that persons affected organizations do every day to fight stigma in their own communities. And I'm not going to focus on language in this presentation because of brevity, but I will be speaking about our projects with persons affected organizations to develop communications and our video and photo projects or imagery projects. If you'd like more information about person-centered language and leprosy, I would encourage you to check out this ILEP policy on their website. So how do we attempt to create an alternate narrative about persons affected through our communications as an organization? So we strive, above all else, to work with persons affected to craft messages. We work together to craft communications products like videos, campaigns, and images. And a few examples of that one would be our work around World Leprosy Day in 2021. So communicators from various leprosy organizations come together to plan World Leprosy Day every year, which is an International Awareness Day for leprosy that occurs the last Sunday of January each year. And this year, GPCL consulted with persons affected around the world to identify the themes for World Leprosy Day for 2021. Our persons affected colleagues selected the central messages based on what was most salient for themselves and their communities, and leprosy communicators worked together to create products that shared these messages, like articles and videos and social media campaigns. Another example of a collaborative approach that we've taken is a project we began around this time last year, actually, when the pandemic was emerging, and it was becoming very clear that persons affected were being disproportionately impacted by the worst consequences of the pandemic and the resulting economic crisis. So GPCL formed a working group to support persons affected and began a consultative project with over 100 persons affected, representing 20+ countries, to gather information about the impact of the pandemic. This information was compiled into a report, which can be found on our website if you're interested, and the key findings were made into a video, which is pictured on this slide. We asked 6 women affected that were a key part of this data collection process to help us convey the findings of the report, and with them created this video, which can be viewed on our YouTube page. So these are just a few very small examples of ways that we have collaborated with persons affected in crafting communications. We as an organization will continue to seek out these opportunities and projects because they're a priority for us. But I will note that these are not necessarily simple projects to undertake because persons affected are all over the world and often do not speak English. So undertaking projects like this does require flexibility with time difference, with challenging internet connections, with translation, and they require planning ahead. It's far easier to sit isolated in an office and just come up with things on my own, but we know that that approach is not as rich and representative. And I'd like to talk a little bit more about challenging stigma through imagery. So imagery is a really important tool, and having photos is key to painting a picture for our audiences that are not within the countries where we work. But as we know from the start of this discussion, photos can be insensitive or reinforcing of stigma and harmful stereotypes. So I'm going to share with you our approach to photography in the field. When crafting images of or about persons affected, there are some guiding principles that we use. Prior to taking any photos, we try and set clear expectations that participation is voluntary and participation is informed. So folks that we're working with know why photos are being taken and what they can be used for, and have given us consent to do so. And then we also try and approach this as a participatory process, so working together to create images. So as the photographer, I'm working to make the pictures that I'm taking as collaborative and as comfortable as possible for the folks in the room that are being photographed. If I'm taking individual photos like portraits, I try and work with the person to decide how they like to be posed, what they're most comfortable with, what the background of the photo should be. And then after the photo is taken, when I can, I like to turn the camera around and review the images together so that they can select photos that they themselves like and think are the truest representation of themselves. So in my experience, taking pictures in this way, where the subject of the photo has agency over the photo, can change the way the subject is portrayed and can result in photos that are more representative of the full person and are more dignified. And as a personal consideration, I think it's important that if we want to take photos that convey dignity, that we do that in a dignified way. So that's how we try and think about field photography. And I'd like to tell you just a few quick stories about these photos that are on this slide. So the image of the young woman that's before you, her name is Mangu, and I met her in southern Nepal at a local health post where she was receiving treatment for leprosy. And it takes real courage to disclose to your family and the people around you that you have leprosy, and she was extraordinarily brave. When she was diagnosed, she told her family, she told her friends, and then she told her neighbors, and then she told her coworkers, and encouraged all of them to go to the health post as well to get checked for the disease. So this just showed extraordinary honesty and bravery. So I asked if I could take her photo, and asked how she'd like to be represented, where she'd like to be seated, what she wanted to do with the scarf that she was holding and with her hands. And I took a few photos, which we then looked at together, and she selected the one that she liked best. And to me, the resulting image conveys the determination and the courage that she displayed in the face of a challenging diagnosis. And I'm thankful that she allowed me to take this photograph and try and convey that bravery. The other photo that's on this slide is of a gentleman that I met in Cebu in the Philippines. And this gentleman was a person affected that lived in a kind of a rural village, and he had a small shoe factory on his property that he owned and ran. So he employed a group of women that lived in the village surrounding his property, and they came in every day and sat with him, and they made shoes, which they then sold to department stores and shoe stores. So when I had the opportunity to meet him, he was telling me about this business, and then was willing to show me about the work that he did. So I had the opportunity to take this photo of him while he was making a pair of women's shoes. And I love this because this gentleman is contextualized in his community, in his life, in his work, doing what he does. And I think this is a story that we don't always get to see of persons affected. We don't always get to see the fullness of their life and what they bring to their communities. So when I'm selecting imagery to use on our website, to use in newsletters, in our external communications, I like to ask myself a few questions. I like to ask, what story is this picture telling? And then I like to interrogate the images that we're using, the images that we have selected. Is this image saying something different, or is it reinforcing tired stereotypes? Does it tell a new side of the story, or does it contribute to the dignity of the person that's being photographed? And finally, I'd like to leave you with some tools and resources as you take these concepts or ideas back to your own work. There are lots of places that you can go to see how this is done well, or to gather some more ideas and resources to apply, as I said, to your own context. I've previously mentioned the ILEP policy for the use of language, photographs, and imagery, and I would encourage you to look that up on their website. I was going to add the Stigma Guides to this as well, but thankfully our next presenter will be moving into discussing that in great detail, which I'm thrilled that she'll be introducing that to us. That's also a wonderful resource. We have tools in our Zero Leprosy Toolkit, which is available on our website, about or related to crafting communications that fight stigma. And so those are freely available, and we would encourage you to look those up on our own website. And UN Special Rapporteur Alice Cruz works in close collaboration with persons affected organizations and individuals. And she's just very recently stood up a YouTube page that features videos of persons affected sharing their stories. And I would encourage you to look at those videos as an example of a way to collaborate with persons affected and sharing the stories of people affected. NNN has a communications toolkit titled Collecting Stories About Neglected Tropical Diseases, a Beginner's Guide to Field Communications. And this is a useful tool for communicators, providing concrete tips and suggestions about capturing stories of persons affected in the field. And finally, Leprosy has a really strong community of persons affected that we rely on to guide our work, to shape the way that we think about and execute communications. So if you work in another NTD that does not have a comparable community of persons affected, I would encourage you to support the groups of persons affected that do exist, and to work as closely with them as possible to try and foster those groups, to support their work and allow it to shape your own. And that brings me to the end of my presentation. Thank you for your attention and for the opportunity to share with you about this topic.
Thank you very much, Andie. That was fantastic and really useful to have all those resources kind of listed in one place. So thank you so much. And what's really incredible is your commitment to kind of completely changing the narrative of the affected persons through the imagery. And it's lovely to see the whole leprosy kind of community coalesce over this movement. Really, it is a movement. We heard yesterday from Professor Diana Lockwood, with more than 3 decades of experience as a public health professional in this field, and as kind of an endpoint of her career in public health, has also made this extremely strong commitment to changing the narrative by launching the New Face for Leprosy project, which again echoes a lot of the things you mentioned today. I welcome everyone to revisit that session as well, which will be recorded and available. But that's hugely important, and hopefully some learnings that we can adapt to lots of other diseases and lots of other affected communities, whether in tropical diseases or even in a wider sense. So thank you. And also thank you for the very nice transition to Roos's presentation about the Stigma Guides. That was not rehearsed at all, but clearly meant to be. So Roos, over to you, and welcome. And thanks for sharing the Stigma Guides with us today.
Yes, thank you, Marianne, and thank you, Andie, for your interesting presentation. Welcome, everyone. This quote is from Adekeye, who is also shown on the picture. It illustrates the way leprosy is perceived in many societies around the world. People often have a negative perception or stigma towards the disease. Stigma is everywhere in our society. Think about, why is it difficult for people to share an STD diagnosis with an ex-partner? Or, for example, think about how people nowadays respond to you when you cough in the supermarkets. Leprosy is one of the most stigmatized diseases known today, and it has been for centuries. But stigma is common in various health and psychological conditions. Many of the 20 diseases that are classified by the WHO as NTD have stigmatizing consequences. So what is stigma? Stigma is a negative response to human differences. Well, who stigmatizes? Stigmatizing attitudes can come from family members, friends, or neighbors. It can come from fellow believers in church, the mosque, or the temple. It can come from employers or colleagues, but importantly, also from health and social workers. Everyone makes assumptions about different groups of people, and people often do not realize that they stigmatize others, and they are not aware of the effects of this behavior. So it's really our responsibility to take joint action to reduce stigma and discrimination and improve mental well-being. What are the effects of stigma? Well, stigma forms a great barrier to tackling NTDs, and it has far-reaching consequences, not only for the persons affected, but for the entire global health system. People with stigmatizing diseases often suffer from restrictions in social participation, like work, relationships, and education. From the perspective of the affected person, these are the most important negative effects of stigma. Furthermore, the effect of stigma may be psychological. So a stigmatized person can experience shame, which can lead to anxiety or depression. And to give an example, 50% of people affected by leprosy face mental health problems. Because of this, or because of discrimination or anticipated stigma, people may no longer take part in social activities. This leads to exclusion, poor mental well-being. Exclusion and discrimination can result in an economic burden for the affected person and their household, aggravating poverty. Stigma may cause people affected to conceal their condition, and the burden of keeping this secret, of being ever watchful and living a lie, can take a huge emotional toll. In addition, non-disclosure to family means loss of support. And because of stigma, many persons with a stigmatized health condition do not seek help. So this delays the diagnosis and treatment and may worsen the health condition, and may also increase the risk of disability. Stigma causes a barrier to preventive behavior. So in the case of infectious diseases, stigma can complicate efforts to control the disease. It can cause a delay in diagnosis and treatment, which may prolong transmission in the community. Stigma may also be a barrier to preventive behavior. So people may refuse to visit a free NTD screening session, or are reluctant to share their diagnosis with other people at risk, or they do not adhere to treatment. So this all increases the risk of further disease transmission, disability, and drug resistance. Stigma has received relatively little attention in national programs. Fortunately, mental well-being and stigma are now increasingly core considerations in NTD programs. Partnerships between the NTD and mental health sector are sought, and this is important. It's very important that health and social welfare departments, NGOs, and other organizations have a really good understanding of what stigma is and what can be done to reduce its impact. So to help understand what stigma is and what can be done to reduce its impact, a temporary expert group has rewritten the Stigma Guides from 2018 to 2020, a process supported by partners from the NTD sector. The writers include specialist researchers, NGO staff, mental health professionals, policymakers, program managers, and people personally affected by NTDs. A separate URL was created. It's stigmaguides.org. The guides consist of 4 modules. Guide 1, what are health-related stigma and mental well-being? Guide 2 is about how to reduce the impact of stigma. Guide 3 is about how to reduce sources of stigma. And Guide 4 is about how to assess health-related stigma and mental well-being. This is a screenshot from Guide 1, Chapter 1, what is stigma? And it shows a video on top. We used multimedia content throughout the guides, including videos. All 4 guides share basic learning goals and provide exercise sheets and tips for its use. The guides are not a training course or program, but the content is rather practical, and we would like to encourage the guides being used in interventions, training, and care packages. And learning, especially on a topic like changing attitudes on stigma, it doesn't happen by lectures, but it really demands a personal learning process. Most exercises in the Stigma Guides, therefore, stimulate active participation and relating the material to the participants' own context and experiences. In the guides, you will find testimonies, case studies, practical tips, links for further reading. And additionally, each module is available in a downloadable PDF format for offline use. When the guides were rewritten, we discussed the requirements for sharing the guides with the NTD community. And we decided to use a Google Translate button for easy translation inside the online guides. The guides are easy to edit, so they are more of a living document, and new contributions can be added at any moment. The guides can be reached via mobile phone, and we monitor how the guides are being used, so we can update the content to increase the usability. So how does it work to monitor the use? For this reason, we have developed a pop-up window in which we briefly ask a few questions to the visitors of the Stigma Guides. And furthermore, we use Google Analytics to analyze the visitors' behavior. So how are the guides used? Well, due to COVID, of course, unfortunately, many NTD programs and interventions have paused, so it's difficult to say something about that. But nevertheless, the guides have been read by people from 79 countries already. Who is using the guides? Well, we asked visitors about their position. And as you can see, the guides are used by a wide variety of users, such as program staff, researchers, policymakers, healthcare professionals, students, fundraisers, but also people who are solely interested to learn more about stigma. We asked visitors how they intend to use the guides, and the guides are used for a wide range of purposes. I personally found it very interesting to see that the guides are intended to be used for a podcast. I really see NTD podcast as an interesting opportunity. maybe for a future collaboration with ISNTD. The previous version of the Stigma Guides, originating from 2011, predominantly focused on leprosy. And the goal of this new version was to make them more inclusive for other NTDs. It's nice to see that this goal has been achieved. The guide's visitors are working on various NTDs, including scabies, Chagas, LF, Yaws, schistosomiasis, trachoma, and more. The Stigma Guides are available via infolab.org and InfoNTD.org. InfoNTD is an online platform that shares information, publications, and tools on cross-cutting issues in NTDs, such as WASH, stigma, mental well-being, and disability inclusion. Many of the research tools that are discussed in the Stigma Guides, such as tools to measure experienced stigma, were already available on InfoNTD, so it therefore made sense to launch the guides via InfoNTD. Some statistics. In 2020, InfoNTD had over 26,000 unique visitors from 191 countries. And by now, we provide access to almost 5,000 NTD resources, of which most are open access. What can we do for you? We provide free document delivery services and to ensure that all valuable NTD resources are easily accessible. And we also offer assistance with literature searches, stimulating research and program capacity. Please contact us to share your scientific or practical NTD materials with the wider NTD community, or follow us on Twitter. Each month we share an overview with the latest NTD resources. Be sure and subscribe to stay up to date. And we're always interested in setting up new partnerships. So please feel free to contact us for more information. The video designed to promote the Stigma Guides is included in the ISNTV Festival Showcase selection on the ISNTD website. Feel free to watch it there or via InfoNTD. And the video also features the story from Adekeye. Thank you for your time.
Thank you so much, Roos, and we're really excited by all those resources you've shared with us, also the partnerships that you've described, and we are very happy to do some podcasts with you. So that's thank you for mentioning it. We're absolutely delighted, agree that the variety of media that you have shown and demonstrated is hugely important in reaching very diverse and different audiences. So thank you. Always a pleasure to collaborate with yourselves. And in fact, a couple of years ago, we gave an award to the Skin app by NLR and InfoLab. And we're just looking forward to taking this up in many different directions. And thank you for that. I think this brings us quite nicely to our next speaker. I think broadening the remit a little bit wider than just a focus on leprosy, but at the same time tackling very much similar issues. It's my absolute pleasure to welcome Dr. Oluwatosin Adekeye. Tosin, you are, as I said earlier on, you're with working on the Countdown Wellbeing study and with Sightsavers Nigeria, and you will be talking to us quite specifically about a very interesting approach to participatory healthcare and using a Photovoice project to tackle NTDs, stigma, and mental well-being. So we're looking forward to hearing more about that.
Okay, good afternoon, everyone, and welcome to this session. So this afternoon, we will be presenting our work, which is a collaborative effort, primarily with people who have been affected by skin NTDs, specifically for groups. We're working with people affected by leprosy, people affected by lymphedema, hydrocele, and Buruli ulcer. And then we're also working with the Liverpool School of Tropical Medicine. We're working with Sightsavers, and also the government of the Federal Ministry of Health in Nigeria, the State Ministry of Health in Kaduna, and the State Ministry of Health in Kwara. So this afternoon, we're looking at Photovoice and the development of support groups in Nigeria. And a lot has been said about stigma, a lot has been said about mental health. And we are looking at taking this forward beyond the information beyond what we know about the relationship between well-being, mental well-being, and stigma, isolation, rejection, and all of that. Beyond that, what next? So our aim is to establish a community-based support system to improve the health and well-being of people affected by neglected tropical diseases affecting the skin in Kaduna and Kwara states, Nigeria. Now, we all know that NTDs often lead to serious long-term physical, impairments, which affect people's health and well-being. They also lead to restrictions to livelihood activities, social interactions. We've heard a lot about that this afternoon, resulting from associated stigma, reduction in participation, and these can really have disabling impacts. Now, on my right hand of the screen, you'll find the map of Nigeria there and the two states where we are working on, right there in gray, Kaduna and Kwara, different geopolitical zones in Nigeria. And we're working in partnership with affected persons, working with caregivers, community health workers, program implementers to co-design and implement community-based support groups focusing on both physical and psychosocial well-being. And this has been a very interesting journey for all of us involved, and you'll see that as we go on. Now, we look at our method. The study uses the community-based participatory research, and we use that to design an intervention in collaboration with the people affected by stigmatizing NTDs. So the whole idea is that collaboration with people affected by skin NTDs, it's not just an implementer approach or just a program approach, but it's creating that space where people affected by skin NTDs also have a say and can direct how all of this, from design right up to implementation, will go. And our study is in 4 phases. First of all, we did a scoping review of a lot of all the literature that looks at skin NTDs and work that's been done with around stigma, around isolation, around well-being, to be able to just have an idea of what's out there, what's been done, what are the gaps, and what would our study be adding to all of this. Within that same phase, which is the phase of reflection, is also the activity of Photovoice that we'll be looking at, in greater detail this afternoon. And that Photovoice has to do with photographs that were taken by persons affected, by NTDs and their caregivers. So they were provided with cameras and they took photos. That leads us to phase 2, where we now have a collaborative action planning with persons affected by skin NTDs, implementers at the various levels of the NTD program, and the research team planning to develop community support group intervention. And then we have the phase 3, which is the action. And that's where we roll out and implement the newly designed community-based support groups in the selected study areas. This is where the study is at currently. This is ongoing right now. And that would now lead us to the phase 4, which is observation, where we will now evaluate the process. All that's related to the establishment of the groups, how the groups function, how they work, the internal workings, what makes it work, what needs to change, and all of that. and outcome evaluation. We want to look at what impact this intervention will have on well-being of the people who are affected, who have attended the support group intervention program. Now, what is Photovoice? Photovoice is a creative participatory method where photos are taken to capture stories. It involves participants taking photos within their communities, and they document their experiences and their realities. It encourages reflection and discussions about important issues in a one-to-one and group discussion about the photographs. And that's the whole idea of this process. As we go on, we will see that we had that one-on-one interaction, with people affected to ask about the photographs. And then we had a group discussion, not just to talk about the photographs, but to also co-analyze and develop themes, for that would take the process forward. And finally, the photos are shared to develop solutions to challenges identified from the photographs. Now, the first thing we did was a Photovoice training. Now, that Photovoice training had to do with first training the research team, and then training a group of people that we refer to as co-researchers. Now, these co-researchers are actually people affected by skin NTDs. So they work together with the research team as co-researchers. All of us were trained, and they now went on to also help in training other persons affected by skin NTDs. So there were 2-level trainings, one for the research team, including co-researchers, and another one where the co-researchers were also involved in training other people affected by skin NTDs. Then came the taking of photographs for 2 weeks and constant visits by the research team to mainly to ascertain the quality of the photographs that were taken, whether there were any issues with the cameras. We had to purchase cameras, teach them how to use cameras. It was exciting for them, because for the first time, a lot of them, had an opportunity to really fiddle with a digital camera. We had our initial concerns about ability to use, but we found out that very quickly they were able to pick up this skill. And those one-on-one interactions also helped us to ask questions, interrogate some of those photos. What's in this photo? Why did you take this photo? How does it relate to your health and well-being? And after that 2 weeks, we now had focus group discussions. Now we had different groups. We had adult males, we had adult females, we had young males, we had young females, and then we had caregivers, separate groups. And like you see in the slide in front of you, we had all the photos. As we made those one-on-one visits, we had them choose what photographs they thought would best represent whatever aspect of their well-being they wanted to discuss. So at the focus group discussion, they all could sit and now look at those photographs. And if you look again on the screen, you will find where you have the sticky notes. They came up with some form of analysis. What are the central themes that run through the photographs? Remember that this was being done by the co-researchers and the people affected, with the research team basically just providing support. Now, what were the findings from the Photovoice? And there are several themes, but I'll just go through a few of them. First of all is the physical functioning and pain. And we have that photograph there, and we have a statement by a younger male affected by lymphedema. They are trashing rice. This kind of work can only be done by a healthy person. An unhealthy person like me cannot do this kind of work, even though I would like to do it. It shows the inability I have to do normal work. Looking at them walking, I'm excited, but I don't feel happy. And that's that part about well-being again. I don't feel happy because my ailment does not give me a chance to do things like this. Then we come to another theme, which is stigma. And this is from a female affected by lymphedema in Kaduna. And she talks about her slippers. She's taking a photograph of her slippers. This shoe, if I keep it at my door, because of my ailment, no one wants to wear it. And that hurts me. Before, someone in the past, someone would pick it, like when you keep a shoe at the door, someone will admire it and want to wear it to the toilet or so. But no one does that now because people are afraid to contract the disease. And that hurts me. And that shows clearly the link between stigma, and mental health. Then we have psychosocial well-being. And that's the photograph of a padlock that a younger male with Buruli ulcer has taken, affected by Buruli ulcer has taken. I feel like my head is locked up because of my ailment. It shows how much I need help to get better so I can stop feeling this way in my head. I'm not fine as a result of this ailment. I always feel as if my head is under a lock. And I think a lot because if I'm fine, I would not be feeling like that. And my head would feel open and I will have understanding of things. Even though I look healthy on the outside, I really am not healthy. And then we have impact on source of income and livelihood. Now, this is a meat shop in the community, and a younger male affected by lymphedema in Kwara now says, I took this photo because it is this job that brought me to this town. But nobody is patronizing me. I've been stigmatized because of my condition. My condition has made living very challenging. With no source of income, I depend solely on my small farm. Another theme that came up was accessibility and quality of healthcare. And here's a caregiver now talking about his experience, with the person he's caring for, an older person affected by lymphedema. My brother goes to this store to buy medicines to ease his pain, but he never gets the right medicine to use. The photo depicts lack of adequate medicines to treat my brother's illness. I feel sad about this situation, and I hope he gets support to get adequate treatment to make him feel better. So it's not just only about the people who have been affected, also their caregivers, also the well-being of their caregivers can also be affected. Then another theme we looked at is relationships with others, support and acceptance specifically. And this is the picture of grinded bean. My caregiver gives to me at a time when I need to take my medicine. That's why I took the picture, to show you what kind of support I get. Whenever I see this picture, I feel loved, that my caregiver is trying all efforts to see that I regain my strength and return to my healthy self. She's supportive and takes good care of me because whatever I think of, she does it like she knows what's in my heart. Now, one thing that this does is also to bring the emotional component, to the research side of the investigation. Now, relationship with others, still talking about support and acceptance. And this is by an older male affected by leprosy. This is a photo of my granddaughter carrying building blocks. I do not have the strength and ability to be part of any groups. Well, except my children make effort in providing for me what to eat and the means to meet my needs. I feel blessed and grateful having a granddaughter that takes so much care of me. She were not here, I do not know what would have become of me. Now, a lot of all these photos, now came together at the end after all the focus groups, and looking at all the photographs and developing the themes. We now went back again to the field to clarify with the people affected and be sure that this is actually a reflection of what they said the photos represent. And then we had these photo booklets, initially on digital form, and we had to go back to the field again to show them the digital format and say to them, are you happy with this? Are there modifications that you want, made to all of this? Remember, it's the community-based participatory approach, so it's driven really by the people affected. Now we have some reflection from the co-researchers, some of who really primarily are people affected by these skin NTDs. And one here says, it's really a thing of joy to be part of something that would help other people who may be suffering with skin stigmatizing diseases like mine. You know, and the female co-researcher says, I'm happy to be part of this program that is trying to help people like me who have been suffering, and no one in the past has been paying attention to us. So it's that shift in power, you know, and they're beginning to feel like we're doing something, we're engaged in doing something that is helping all of this process. From the photo booklets, we now move on to a photo exhibition, a one-day photo exhibition. And the photo exhibition came about, you know, by looking at the photographs with the persons affected to say, what pictures would you like to take to the photo exhibition? And those pictures were now put up in a large banner, like you can see, and like you would usually have in a typical research photo exhibition. We had the persons affected, you know, and then at that meeting, we had the implementers at the various levels, health workers at the state, at the local government, and at the federal level, including the research teams. Now come listen to the persons affected, now tell their story about why, you know, they took the photos that they took. Now, that exhibition now took us to the second day of an intervention design meeting, you know, where we started the conversation by looking at support groups that have been established relating to other disease or other conditions in other countries, in other areas. And this sparked an interest, you know, in the people affected. And initially there was that anxiety around whether it was going to be easy to shift positionality from implementers to persons affected. But we found out that after the presentation, you know, the people affected began to come up with, this is what we want, this is how we want the groups to run. Basically, the agreement was to have two groups, one that meets regularly at the community level and one that meets once a month at the district or the local government level. So we have a terms of reference and the development of support groups, you know, titled Getting Through It Together. You know, and the priority areas, you know, to provide space for supportive network where people living with skin NTDs can share experiences and challenges, you know, confidentially. Now, remember that all of this is driven, all these priority areas, driven by the people affected, you know, and all we were doing was to document what they said they wanted in the groups. Secondly, to provide mutual psychosocial support with shared discussion on how best to deal with challenges. Thirdly, to discuss how to manage conditions and live positively. Also, to strengthen knowledge about conditions, share health information. You know, there were certain things that they wanted, you know, added to their group meetings, you know, things relating to wound care, you know, things relating to occupational skills, you know, things relating to how to manage, you know, certain aspects of their lives, you know, and that engagement now, and this is where the implementers became it became critical to engage the implementers, you know, to say, what can you provide for us, you know, as we meet as a group that will help improve our livelihood, you know, and also finally to initiate group savings processes through a monthly membership fee of 100 naira at the district level used to run the group and help meet smaller needs of the members. Now, currently, between day before yesterday and today, the first district or local government group meetings have taken place, and that's a picture there of the one that has taken place in Kwara. I just got information from the one that is taking place presently in Kaduna, and a lot of excitement. They've been able to recruit, you know, new people in their communities to join the groups, you know, apart from the initial people affected that were part of the Photovoice method. There are now new people who have come to this first time group, you know, and a lot of them are saying there are still more people and they will join us as the group continues to meet. There's a lot of excitement. The membership fee, one of the research team was telling me this earlier on this morning. All of them have paid the research, the membership fee, and they're looking at how to use that to help themselves if they have to engage people to go to the farm on their behalf, little things that would help improve their lives. Basically, we see a lot of enthusiasm, a lot of being happy. In fact, the fact that the Photovoice method took place, we began to hear things like, for the first time, we can come to the local government. We can all sit here. We have you people who don't have this condition. Sit with us and not stigmatize us. That in itself is a plus, and constantly they keep calling, oh, we're doing well. When next are you coming? And all of that excitement, because of, the creation of that space for engagement. Thank you very much.
Wow, so energizing, so inspiring. And what's, the photos, the stories, the affected persons speak for themselves. But what's really incredible is that within all that, the main strand of thought is, what can this do for others like me? And that kind of empathy for the other is really shines through and is wonderful. So thank you. An incredible project. You can see the whole photo book on our website. I'd encourage everyone to go and view that. And so thank you for sharing all that detail and really taking us behind the scene there. It's absolutely fantastic. Thank you, Tosin. And so this brings us to the last presentation and the last example of advocacy in this space, and basically how to do it. How can we reach out to those affected communities and at the same time reach out as well to the wider audience, given the hugely misunderstood conditions and diseases that are skin neglected diseases. So I'd like to hand over to Hannah. Hannah, you're speaking on behalf of the Leprosy Mission, England and Wales. You're a digital innovation manager, so you're the brains behind the campaigns, and it'd be wonderful to hear more about the Leprosy Mission England and Wales's more recent campaign called the Unconditional Appeal. So over to you, Hannah.
So last year, the Leprosy Mission England and Wales was awarded UK aid match funding for a project that we're running in Mozambique. And so we, of course, immediately needed to get to work thinking about how we were going to communicate about this project to our supporters, as well as how we were going to communicate it in country in Mozambique. The project is quite wide-ranging. It's focused on completely transforming people's lives, basically, in a variety of ways, but starting with the starting point that people go undiagnosed with leprosy, and people find it hard to get treatment for a variety of reasons. And some of those are, firstly, we've got the weak health infrastructure in remote rural areas. Many of the people that we work with, they would have to walk for several hours to find their closest health post. And so that makes it really difficult to get medical care sometimes. There's often also little specialist leprosy knowledge among healthcare professionals and traditional healers, so who are often people's first point of contact when they're unwell. So that means that when people do have leprosy, they're often given inaccurate information about how to treat the disease. In addition, we've got quite high rates of leprosy in the specific districts that we're working in Mozambique, which is in the northeast of the country. And then we've got people generally being unaware of the early signs of leprosy and how it develops. So I think something that a lot of the people we work with have in common is that they will notice the early signs, but think it was nothing too much to worry about, or think it was a minor skin condition, or get some help from a traditional healer that obviously doesn't treat the disease. And then things start to get worse and they don't seek medical attention until complications have already developed. And then we've got the stigma around the disease that still persists, which affects people in so many different ways. Obviously, It makes them more unlikely to seek treatment. It makes people likely to isolate themselves and self-stigmatize. It affects mental health and their general quality of life, but also then in turn, they might be stigmatized by their communities. And the effects are knock-on, aren't they? You know, people are more likely to drop out of education, they're more likely to live in poverty. And that's really exacerbated in the particular Mozambique that we're working in, because it's particularly affected by climate change and the extremes of weather that make subsistence farming quite difficult. Here in the UK, we've got some additional barriers to overcome with communicating the issue to supporters and potential supporters. There is in general a real lack of awareness about leprosy as an issue. We find that the older people are, the more aware they are likely to be about the disease, but particularly with the under 60s, awareness is very low. It's also quite a complex disease to communicate to people about. Many people know that there's a cure for leprosy, but then the question that they will next ask is, well, why hasn't the problem of leprosy been solved then if there's a cure? And of course, we know why the issue of leprosy is so wide-ranging, but it can be quite complex sometimes to communicate to people. We've also faced the barrier of winning support for a campaign during a pandemic, when people are so focused on what's going on in their own country. People have many worries in their own lives, and I think we were possibly a bit worried that people would be very focused on things close to home right now, and not be so concerned about what was happening overseas. From our point of view, we're not able to travel to Mozambique right now, so we had to find ways of getting stories, thinking about how we were going to actually interact with people and provide this picture of a campaign to an audience at home when we couldn't actually visit the country ourselves. We'd also got the additional concern, I guess, that our supporters in England and Wales are historically very supportive of our appeals that focus on India and Nepal. I think they're very bought in to our work there, which is very hospital focused, because we do have hospitals there, and that enables us to ask for things that are quite tangible. Hospitals provide the opportunity for building projects. They provide the opportunity to for us to ask for things around surgery and medical treatment, whereas our work in Mozambique and the other countries that we work in Africa, actually, it can sometimes be less tangible because a lot of it is more community-based and less focused on hospitals. So we knew we had to come up with a really innovative way of communicating the project. And this is how the project itself is working. It's starting by tackling low awareness of leprosy through local initiatives. Where there is low awareness, volunteers are communicating to groups of people at community meetings and to individuals by going house to house the early signs of leprosy, the necessity of seeking treatment, and the fact there is a cure, because, you know, that's something that people don't always realise. The project will also mean that these messages can be broadcast on radio and on social media, and they'll also be able to transmit messages in communities through traditional ways as well. Song is used a lot in the communities we work with, and so our volunteers have been doing a lot of work through song and dance to raise awareness. Another branch of the project is that it involves a lot of specialist leprosy training for health workers, nurses and traditional healers as well, so that they can all work together to find and treat new cases. So this will be a really joined up way of working towards the goal of finding and curing as many people as possible. They're also going to work with local leprosy committees made up of people affected by the disease, who are really motivated themselves to do what they can to end leprosy. And through building this network, we hope that everything will be more effective. The project is also quite innovative because leprosy changemakers, we're calling them, people affected by leprosy themselves, who are often volunteering in their communities, are going to be at the centre of what we do. We talk a lot with this project about how it is equipping people affected by leprosy to lead the way to a leprosy-free future for their communities. And we're putting them at the heart of all we do. Rather than presenting it in the way that we are going and doing things, it is really about equipping people affected by leprosy themselves to create change. Final main facet of the campaign is that community hubs, so buildings in villages, will be built and equipped, including with Raspberry Pi technology, so that communities can come together, they can learn, they can organise, they can hear health-related messages, and they can work towards inclusion for everybody, breaking down the barriers of stigma, and making sure that nobody does feel like they can't be involved in things. At the hubs, there'll also be the opportunity to learn about climate change and improve farming methods, so that people can have greater yields and more secure future for their families, so that they can start growing more, so that they can also earn a livelihood from their farming. In terms of how this plays out in communications and fundraising, we realised we wanted a really fresh new look for this appeal. In terms of how that looks, we've recently started working with new designers and refreshed our branding with the goal of making everything just look more exciting, more vibrant and contemporary. We really wanted to use language as well that communicates the appeal in an exciting and dynamic way, centering people affected by leprosy more than ever before. Other speakers on the panel have talked a bit about this. I'm not going to expand on it too much, but it comes across in the words you use, doesn't it? It comes across in the photography that we use. It comes across in the way that we present people affected by leprosy. And what we wanted to do as well, through putting people affected by leprosy at the centre of everything, is also bringing our supporters here in England and Wales closer to life in Mozambique. And the lives of people living there. It is so far away. A lot of people don't know much about Mozambique, and the closer they can get to the lives of people living there, the better. We also worked with a creative agency on this appeal for the first time. We've tended to do everything in-house before in terms of coming up with concepts and strategic comms, but we thought it would be really good to get a fresh perspective on things. And this challenged us in many ways. I think it encouraged us to think outside the box. It encouraged us to resist the temptation to fall back on themes that we're used to using, the language that we're used to using. And it was really good to get that insight from them. One of the key concepts that they came up with for the campaign was that we were going to centre everything around the phrase "everyone welcome," in that at its core, the unconditional appeal is about breaking down stigma and making sure that everybody is welcome in their communities, everybody is included. Some of the key stories that we had from people in Mozambique, when we met them, they talked about being rejected by their loved ones. They talked about being asked to move away from the village, being told to go and live elsewhere because people didn't want them around. And so that concept of everybody now being welcome and included as a result of everything that's happening is really important. We also, for the first time, in a bid to reach out to new audiences, really have gone down the route of doing some Facebook acquisition, which comprises a pledge with follow-up asks, an email series, etc. And that's getting new people involved with us as an organisation and building people's awareness of leprosy. The email series involved a quiz. It included telling people more about the disease, sharing stories of people affected by leprosy, sharing some videos. And our goal with that is that we would really reach outside our existing supporters to bring our messaging to different audiences. I'm just going to talk a little bit about the messaging here as well that we've used when we communicate to supporters. We have gone for quite dynamic messaging. I think sometimes as an organisation, we have been guilty of being a bit tentative in the way that we talk about our work. But this time we wanted to be quite bold in our messaging and say that, this is it. This this is our chance and this is your chance as donors to really make a difference and make big strides towards ending leprosy in Mozambique. And really as well to make the dynamic attitudes and the dedication and the perseverance of the people affected by leprosy themselves come through, because we've really met some amazing people affected by the disease who are doing so much in their communities. And so I won't read it all out, but you can see there some of the core messaging that we've been using. It's really important for us to bring across how people aren't just going to be giving us a donation that will, you know, do one small thing at one time. It's that they're partnering with a network of people in Mozambique who are going to be hoping to end leprosy and poverty for generations to come in their communities. I wanted to finish up by showing you some of the things that we've ended up with as a result of all this. But I'll just go through some examples of the asks first. In terms of talking about tangibility, I did mention earlier that sometimes it's harder to be more tangible with the asks for countries in Africa because they are often not related to hospitals and buildings as such. But as you can see, there are many different things that our supporters have been able to envisage in terms of what their gift can do and how that can transform people's lives. I'm going to show you some of the collateral that we've ended up here and how we brought across that messaging and our goals for the campaign through what we've produced. We had a completely new look for our magazine. As you can see there, it is focused quite a lot on imagery. We've done lots of white space and less copy. I think we've sometimes been quite guilty of having too much wordiness and not enough pictures that are really showcasing what's happening in the field. So we really wanted to show as much in terms of photos as we could. We're really fortunate in that we've been able to make some amazing contacts with photographers in the countries that we're working in as a result of not being able to travel. My colleague who looks after everything photo and video related has been really hard at work building relationships with photographers in country. And it's down to them that we've got these resources, which, as you can see, are some really, really good photos. We have gone for the same kind of concept with the advertising. In the past, in years gone by, before we really started to look at how we were portraying people affected by leprosy, I think sometimes the default was to show people, you know, looking quite miserable, showing disability and kind of focusing on it, not showing people looking happy. Whereas actually what we really wanted to come across here was the vitality and determination and dedication of the people who are working in their communities to end leprosy. So we have much more natural shots of them, I think, than we would have probably had in the past. And the same thing comes through in the leaflet that we produced that went out to supporters. This kind of no matter what messaging is something that we're using a lot through the campaign in terms of, you know, no matter how far our health workers and volunteers, they travel over quite long distances in order to carry out their roles. No matter what, it's often people doing what they need to do against all odds and in quite difficult situations. And we really wanted to bring that across to our supporters. For the first time, we've had a campaign microsite as well, which is accessible from our main website, but slightly separate as well, so that people can go and find out more about the campaign, but meet the people who are involved in the project. And we've got, as you can see there, there's kind of interactive map of one of the villages that we're working in, where you could click in different points in the map and meet different people, see different aspects of the village. And that's been a really great resource for people to find out more about the appeal. You can see, you know, videos on the site as well. And this is the Facebook pledge that we've been using for acquisition. We've been doing a lot of testing, different messaging to reach new audiences. What we found, we tried out 3 different types of messaging at the beginning, and the messaging focused on isolation. The isolation felt by people affected by leprosy was actually the winner. And we feel that this has come across really well with supporters here in the UK, because it's something that's very close to everybody's hearts right now. We've had a year of various types of lockdown, and people have not been able to see their families. People who live alone have often been alone for a very long time. And I think it's something that's so close to people's hearts right now and is really prompting them to act. And that's good because, you know, sometimes we think, oh, it's quite hard to connect people in this country up with the reality of leprosy and how it affects people's lives. But we've seen that focusing on the effects of stigma and the effects of leprosy on people's well-being, that people actually really resonate with that. And once people have signed up to one of those pledges online, they're kind of being onboarded, as it were, into the organisation, being introduced to our work. And we're really hoping that this is going to revitalise a kind of, you know, a new generation of leprosy mission supporters, and that we hope to continue doing this kind of work on Facebook quite a long time into the future. Thank you.
Thank you very much, Hannah. That was really enlightening, and thank you for sharing that much detail about this incredible new campaign that you've launched. It's really interesting that you mentioned bringing in kind of outside creative influence for the first time. It's true that I suppose as a public health or NTD community, we get used to the same kind of language, turns of phrases, and also because we all sort of using the same pool of vocabulary and also concepts, but it can be difficult to imagine, but for many people, perhaps even words such as stakeholder or endemicity might not be very familiar. So it's really wonderful to see those new ideas, new approach, and the mix of creative and social media, of course, and all those new strategies that kind of can combine and come together to really affect change. And of course, in the process, bringing in those all important donations, but ultimately really affecting the outcomes for affected persons. So thank you for sharing that. And I suppose this would be a good time to bring everyone back and think a little bit in more broad terms about something that's been really common to everyone's presentation, and that was the representation of the affected persons, whether it be through their own lens, quite literally in Tosin's, the case of Tosin's presentation, and also what we discussed at length yesterday and today, really that sense of agency, putting the control of the image and the story right in the hands of the affected persons. And it certainly feels as though this is now a major turning point in terms of tropical diseases, in terms of neglected communities. There's a great example of that as well in the Malaria No More campaign that was launched recently, and again, moving away from communities really crushed by malaria. It's a very dynamic, and you mentioned, Hannah, the word vitality, and I think that's really what will bring this forward. So I was just going to ask really all the panelists, and feel free to put your cameras back on as and when you would like to. We've talked a lot about misconception about leprosy, and I suppose what these projects have been great at doing is really highlighting the affected person's voice. And then at the other end of the spectrum, there's sort of the broader audiences, and somewhere in between there needs to be someone or something to relay the messages, the voice of the patients to that very broad audience. In your case, Hannah, that's taken shape in this wonderful campaign, but lots of times it will be down to perhaps the media or local media. And I was just wondering, This is something that we discussed yesterday a lot in terms of misinformation, misconceptions. What can be improved in the relationship, perhaps the role of media in taking that patient message and that patient voice and bringing that to wider audiences? And I don't know who'd like to start. Maybe Hannah, because you're just kind of fresh off the launch of this wonderful campaign. I'm assuming that's something that you had to bear in mind and consider.
Yeah, definitely, and particularly as well because it's a UK Age Match campaign. The messaging is really important. You have to run all your messaging through the government's communication partner, because again, they're just as keen as we are that we don't fall into problematic ways of portraying people and problematic ways of portraying development. And so that's been a big process for us really over the last few years of moving towards a much more positive way, I think, of communicating things. But I think you still get the problem sometimes that when talking about the mainstream media, that they will prefer images, for example, in particular, which are quite sensationalized and, can be quite dehumanizing even sometimes. But that's what they want to see, because for them, it's portraying the kind of extremes of leprosy, and this is what can happen to people. And so you do have to battle that a bit. We've done quite a bit of work over the last couple of years on our photography policies, and what we do and don't use, what we will and won't supply to people. And obviously there is a place for using images that show disability as a result of leprosy. It's not that we can't show those pictures. It's more about what the picture says as a whole, isn't it? As I said earlier on, in that we just have to make sure as much as we can that what we're supplying to the media isn't dehumanizing, and shows people in as rounded a light as possible.
Andie, you've been nodding in support of that.
Yeah, absolutely. Yeah. And I think the way that we approach this is, as I said in my presentation, is to try and stay as close to persons affected as we can as we craft these communications. And as we're working with the media, if the media approaches us, we want to try and make sure that the voices of persons affected are coming across and that we're not diluting those messages, or just to make sure that those voices are the most important and are driving the conversation. And as I mentioned in our presentation, that we have persons affected that sit on our leadership team and on our working groups. And so we have these conversations on a regular and ongoing basis to ensure that we're staying in line with what we believe.
Fantastic. Roos and Anne, did you have any thoughts on that? Well, how do you feel that media could be a very helpful tool in amplifying these patient voices?
I think there's really a role for us to empower persons affected. The leprosy organizations are also talking about champions, so empowering people affected to write their own stories and share these with also local media sources, so that their stories are heard, and it's not our perspective as NGOs on leprosy and what it is like to be affected by leprosy. So I think it's really important to focus on this empowerment, and not only on how to tell a story, but also
plays a very important role in, helping to empower persons affected, to tell their story. I think the critical thing is that they are telling their story as they want it told, and to ensure that we do not lose the strength in the way they want it told, is like with the experience from our study about pictures, is to keep going back to say, am I getting this correct? Is you said this is how you want this story told? Is that exactly how you want it told? To just ensure that it's told, it's projected the way they want it projected. The tendency many times is, when you're listening to somebody from outside, is to want to also allow your mind to get involved in what they are saying and to try to complete sentences, you know, for people. Now, again, with engaging with people affected, many times you said something earlier on about language, you know, use of terminology, you know, and all of that. They may not use the terminologies that we are used to using. And we need to be careful that we're not completing statements with our own terminologies that are not saying what they want said. So it's that case of revalidating and keep revalidating to ensure that we don't lose the meaning.
That's hugely important. And I suppose moving away a little bit from the communities and thinking about, for example, elimination goals and kind of on a public health agenda, perhaps what you're referring to could also really inform one of the three major shifts of, as an example, the NTD roadmap, which is to really focus on impact rather than process. And do you think that there's a huge role for these patient voices to actually inform public health programs of what impact means to those communities themselves?
Yes, I think so, because now we're seeing that there's quite some engagement of people affected. And we're beginning to see that, first of all, there's been this huge assumption that those of us who have had some training, some experience, you know, and all of that, know what we think the community wants. But then we now have people affected saying, this is what we want. This is how we want it. I'll give you an example. Just this afternoon, you know, I was called from the field to say, contextually, you know, in the north of Nigeria, usually men and women would not sit together at a meeting, you know, but then they are saying, we want to sit together first and have general conversations. And then we want to later on break into separate groups, you know, to have more detailed conversations. Now, we sat in the office to say, oh, we think because of the context, the social context, this is what it should look like. But let's be open so that when we get there, they will drive this. So also in terms of impact, I think it's that place of engaging with them and listening to them and allowing them to also decide.
That was a great example, but do you have other examples whereby the patient voice has kind of redefined or put goals and the impact in a new light? Maybe Andie, if you want to go first.
Sure, yeah, I'll speak a little more generally than a specific example, but something that we talk about quite a bit is expertise and what constitutes an expert, because we have an idea of who a leprosy expert is, but persons affected are experts. They're experts in what it means to be a person that has been impacted by this disease, and they have lived life experience that gives them expertise as leprosy experts. So it's a different kind of expertise than we maybe traditionally think of when we think of a leprosy expert, but it is expertise. And so we need to be listening to those people as closely as we are the leprosy experts. You know? So we have that discussion a lot amongst our group.
That's very important. Roos and Anne, would you like to add something?
I know an example from Indonesia where the SARI study was organized, and in this study, persons affected were drawing comic stories about their experiences and their lives, and they were sharing these with schools in their own environment. So this is really, I think, an interesting and inspiring way to really share stories from persons affected, really from their own initiative on, you know, what topics are important about their own stories and how to share them with their own communities as well. And of course, you know, those stories can then be taken up also to maybe national media sources. But I think it's also important to focus on the communities where the persons affected live as well, because that's also where the stigma is.
Fantastic. Would anyone else like to add something to this point? So I suppose just to conclude this session, I'd like to ask you one last question. We There's been a lot of focus, of course, on persons affected by leprosy, and I was just wondering, is there enough of a platform, or is that something that could be worked on to share this kind of thinking and your findings and the very practical approaches across all skin NTDs, or is that something that needs to still be developed? Does it remain fairly disease specific?
I think maybe InfoNTD can be a great platform for this. As I know from Roos that InfoNTD was also hoping to focus more on the skin NTDs and is currently collecting content on this topic, but maybe she can say something more on this herself.
Yes, definitely. We're of course already sharing a lot of materials on the cross-cutting issues in NTDs. We're also currently in the process of setting up a page specifically on skin NTDs, and we're always open for new partnerships and disseminating different resources. So we could definitely we are supporting that, and we're open to share more resources and also invite people to share the resources with us so we can distribute them with the wider NTD society.
Fantastic. We will do. We've heard that message loud and clear. Thank you.
Thank you.
Hannah, Andie, Tosin? Do you feel that enough has been done across skin diseases, particularly neglected skin diseases?
I certainly think there's still more to do. I think there's still more to do within leprosy. I do say, though, that I think that leprosy offers some gifts to the overall NTD community in having strong organizations of persons affected and historic relationships with these groups. I think that there are some models within leprosy that could be brought to some of the other skin NTDs that could help all of us do what we do better.
Fantastic. Hannah,
Yeah,
of course. Sorry, Tosin.
Yeah, okay, well, I think, again, sharing from some of our experience, when we began this study, we had to work with the leprosy unit, which is usually... Sorry?
Oh, sorry.
Oh, okay. Yeah, so which is usually a different unit, from the NTD unit. And I think coming together, the coming together of the two departments, brought quite some cross-cutting learning, because when we came to the intervention meeting, because the leprosy unit is used to a lot of learning, across both groups. But when you look at the persons affected, they really don't have any differences in departments. As far as they are concerned, we have challenges because we have skin NTDs, and there's no difference between all of us. What binds us together is the challenge, of having to live with this disease, so to speak. So I think it's helping the program. There's that learning that's coming from a lot of work that's happened in leprosy that NTD can also learn from.
Fantastic. Then we totally second that for sure. It's a hugely prolific community, very dedicated to the affected persons. That's definitely shown through all the presentations and through all the work of the organizations involved. I'm afraid we've come to the end. We've actually overrun. There's never enough time, and it felt we're only just getting started on what's certainly going to be a very engaging process, and with lots more to come, no doubt, in these very creative approaches to tackling the hugely difficult issues that are faced by persons affected by skin neglected tropical diseases. So I think at this point we should come to a close for now. And again, thank very much all our speakers today. It's been a huge source of inspiration, and thank you for the huge breadth of examples in the field, but also the very kind of deep thinking about the persons affected and about the issues at stake here. So a very big thank you. I'm sure the audience will join me in giving you all a round of applause, and we're looking forward to hearing more from all your projects and your organizations. But in the meantime, for now, it's a thank you and goodbye, and we hope to catch up very soon.